Hi everyone, I'm Chris Harrop, I'm the Managing Director at MIAA, and I'd like to wish everybody a happy new year. I think it's the time of year when everyone takes a bit of time to reflect and to think about what's coming in the new year. So I just wanted to use this opportunity to just say a little bit about what MIAA can do to support clients at such a difficult time for the public sector right now. So I'm going to run through some of our services. I'm going to start with our core service, our assurance service, and that's predominantly our internal audit offer. So we've been around for a long time. We've been in existence for over 30 years. We've got lots of very experienced staff, some of whom, like me, have worked in providers and different organisations that we support. And I think having that perspective gives us a unique ability to really understand what good looks like, to be able to compare against organisations and to do some benchmarking, and to use that evidence, to use that data to genuinely add value to our clients in everything that we do. We also have significant reach, so we cover 5 different regions across the north of England. We also operate services into North Wales. We've got some services and clients in the Isle of Man and further afield. We've recently won a contract with NHS England, so we operate at a national level as well. We also influence through our work that we do with groups such as the Healthcare Financial Management Organisation, and we work as part of various groups to support internal audit standards and development. So we're in a position where not only can we say hand on heart we deliver valuable services, but we also influence and create an approach that I think sets the agenda in certain areas. Moving on, I'd like to just say a little bit about our anti-fraud service. Recent estimates have suggested that there's over £1 billion worth of fraud that takes place within the NHS alone. And as I've said, in terms of our assurance service, we've got a very experienced team that's been around a long time. We can provide support in a number of areas. That could take the form of advice and guidance to colleagues within organisations as to how to approach these kinds of conversations, because they are very tricky. It could be around promoting fraud awareness. What does fraud look like? What kind of things would manifest themselves as a fraud? But also, at the sharp end, it can be how we investigate and support organisations to look at investigating fraud. So there are clearly lots of areas that we can support here. Our solution service is an area that we've developed over the last few years, and in particular, we're very proud of the work that we've done this year in a number of key areas. We are supporting all 3 of the North West integrated care boards with their continuing healthcare services, and that's led to a number of improvements. We're optimising care packages for patients. We are genuinely saving significant sums of money for our clients, and all of that is adding tremendous value. We have a number of other services that we're very proud to be able to offer as well. So we have a programme management team which can provide support on various projects. We have a business intelligence service that again can provide a range of support, looking at data analytics and providing evidence to hopefully look at new projects and areas of improvement. And finally, I think I'd like to talk about our clinical services that we offer as part of this setup. So we have a healthcare quality and transformation team which spans both assurance and solutions. And within that, we have a range of experts who've worked in the service, they've got clinical backgrounds, and that covers colleagues that have worked in both nursing and medical roles. So if you've got any concerns about clinical safety issues or risk, we've got staff who've got years of experience that can come and help. We have some fairly specialist areas of service as well. So in terms of our digital offer, we have significant expertise and experience in cyber security. Of course, that's something that's very topical at the moment, and it's an area of concern for most of our clients, I'm sure. We also provide a service to one of our integrated care boards in relation to information governance. So as well as being able to offer audit and advisory support in that area, we have got a track record now of delivering information governance services for our clients. So they're just a couple of examples of some of the things that we look at from a digital perspective, but there are more, and I've touched on the business intelligence service as well. If I've raised anything that's piqued your interest, then by all means get in touch with me or the senior team. All the best for the year ahead, and please get in touch. Thank you.